Well, hello, everybody. My name is Peter Werwine, and I am Senior Editor of Managed Healthcare Executive. And today I'm speaking to Dr. Peter Antall, who's the Chief Medical Officer of Amwell. Now, Amwell, of course, is in the news a lot these days, partly because it's such a hot stock. The IPO was mid-September. It's now trading north of $32, which is roughly about an 80% increase from the IPO price. And of course, telehealth in general has surged as a result of COVID-19, and Amwell has benefited from that surge and served that surge. Dr. Antall is also president of some of the Amwell Care Group, which is a professional organization of physicians, roughly 600 physicians, right, that provides clinical services to Amwell. So he is both the CMO and president of a group that provides clinical services to the company. He's a graduate of George Washington University. That's where he got his medical degree, and he did his residency in pediatrics at Case Western, I believe. So thanks for making time today. I hope all the information I gave in the introduction is accurate. So
yeah, Peter, thank you for having me. And I think generally, yes. The only thing I would clarify, I think, if I'm not mistaken, the number we share in terms of provider numbers currently is somewhere in the 4,600 range of active providers.
Wow. So
I would refer to my S1 if I'm mistaken in that number, but I believe it's right around that.
Wow, the number I saw, I guess, was an old number.
May have been an old number, sure.
So just to sort of create a baseline of understanding, of course, people who follow telehealth know Amwell well, but maybe you could just, in sort of a elevator speech fashion, sketch what Amwell does exactly in telehealth. Is it a direct-to-consumer company? Are you getting into any sort of provider-to-provider services? And who are your customers? You know, obviously you're dealing with patients, but who hires you to provide those services?
Yeah, sure, Peter. Great question. Our founders, our two CEO brothers, and a few others that they were working with, way back in 2008, they had a vision. And the vision was, let's create a platform that allows patients and providers to interact electronically. Now, it was a different time back then. This was before we even had such a thing as a smartphone. So it was a very different time. It was really based on the technology at that time, which was computers. But once we moved into a whole new phase of technology available to consumers with smartphones and tablets, the vision just expanded from there. And I think that vision still holds true. We at Amwell, we really are about creating technology, primarily software, but also hardware, and creating essentially an ecosystem that allows healthcare to be delivered in a robust way and in an electronic way. Now, increasingly, that vision is being realized by patients seeing known providers. Traditionally, I shouldn't say traditionally, but to date, a lot of the telehealth that's happened has been done so by creating a cadre of providers that are exclusively available by telehealth, and hence not known providers to the patients. But little by little, over time, providers in the community have embraced telehealth, and our provider survey has followed that progress along. But really, COVID supersized that. So now, really, what we're seeing is providers en masse have embraced telehealth. Patients have embraced telehealth, and we've really seen the result, which is a massive increase in the utilization of telehealth in general.
So does that mean that Amwell is increasingly working with physician groups and setting them up to provide telehealth services to their existing panel of patients?
It does. And going back to the other part of your original question, we have lots of different types of clients at Amwell. We certainly work directly with providers and with large provider groups and hospital systems. And we've worked for a long time in engaging them. Again, as I mentioned earlier, to use telehealth as a tool, another tool in their toolkit to help care for their patients. We also work with health plans. And they often are the ones that bring the demand. They have many, many patients and members. And importantly, what health plans can also bring is telehealth as a reimbursable event. Then there are a number of miscellaneous clients we work with. We work directly with employers on some occasions, or to a larger extent, we work with employers through the health plan partners of ours. And then we work with tech companies as well. Telehealth is broadening and expanding into new areas like remote patient monitoring. We worked with Apple on the Apple Heart Study, studying the use of a smartwatch to detect a heart condition. And other, you may have seen our recent investment from Google. Google is also interested and has their own strategy around telehealth.
So would you compare and contrast yourself to Teledoc? What does Amwell do differently than what Teledoc does?
Sure. Yeah. We are often compared in the marketplace. Our names come up in unison regularly. I have some colleagues and friends over there, and I respect the work that they do, but we are fundamentally different companies and with different strategies. I think Teledoc has done extremely well and executed well in the employer space and in the health plan space, and they've worked to execute in the health system space, but have been, I would argue, behind us in that space for many years. What's really different about us, though, is we are about the software and the hardware. When we provide software to an organization, we white label it under their brand, and we encourage the organization to bring their members, if they're a health plan, or their providers, if they're a health system, as well as their patients, and bring them and allow care to happen organically on their system. Now, do we have a direct-to-consumer offering? Do we have a medical group? We do, as we mentioned earlier. So we can bring that as well, but more often than not, we're bringing our medical group to bear on the behalf of the owner of that white label platform at their discretion, and to back them up and provide a reliable supply of providers.
So it's likely that the average person, the average patient, who might have taken advantage of a telehealth service provided by their doctor or a specialist in a hospital system, that they wouldn't know necessarily that they were experiencing an Amwell experience. You sort of are working in the background, and the service carries the brand or the imprimatur of the practicing physician.
That's correct. I mean, it sounds hokey to say, but to borrow from another company and another technology, we're sort of the Intel inside. We provide a plug and play software solution or hardware solution. We may bring along providers if we're asked to, but we really try, and we of course bring along a lot of support services, whether that's marketing, whether that's professional services, patient support services, etc. But yeah, that's really what we bring to the table. We trust our clients as for example, hospital systems. We trust that they know what's best when it comes to delivering care. They know their patient population, they know their geography, they have their own cadre and roster of specialists. We trust that they'll provide good care as long as they have the technology and the support to do so.
And even though you work in this white label way, could you identify some of the major health systems that have signed on with Amwell this year in, amid the telehealth surge?
I'm a little bit, I apologize, I'm a little bit far removed from that. There's a lot of incoming of new hospital systems. So I would have to defer that question to somebody on our sales team. I apologize. I'd be happy to acknowledge, however, that we really have some industry leading health systems in our portfolio, including hospitals like Cleveland Clinic, Intermountain Healthcare in the Western region, UPMC, New York Presbyterian, and many, many others. And I apologize for those that I'm leaving out. There are many, many wonderful institutions that we work with on a day-to-day basis.
I guess you're like the Academy Award winner who forgets the thing. So, the surge in the use of telehealth has been discussed quite a bit. Is there any sort of salient statistic that you would share with us that would sort of capture or illustrate the growth in what Amwell is doing in 2020? I'm just wondering, if numbers tell stories, is there one or two numbers that maybe you would share with us that would illustrate this surge that everybody's reading and talking about?
Sure. Let me, I want to make sure I'm consistent with what the numbers we're sharing out in the marketplace. But in April of this year, we all know that there was sort of or most know that there was sort of a 3-week explosion of COVID cases in kind of the March timeframe. But if we look in April of this year, our volumes of patient visits on our platforms was up 300%. Sorry, let me rephrase that. In Q2 of this year, our volumes were up 300% over Q1. And Q1 was, flu season. So for that bit of work that's seasonal, we were still well above that in Q2. I think our monthly active providers in Q2 was up 400% over that in Q1 over all of our platforms. And maybe a better demonstration of the impact of COVID, for example, in April of 2020, average daily visits on our platforms went as over 40,000 visits per day. And that's as compared to 5,500 in January of this year. And if we look all the way back a year earlier, April of 2019, 2,900 visits a day average during April of 2019. So dramatic increases.
Yeah, doing math in my head has never been a strong suit, but 2,900 up to 40,000. I mean,
yeah, it's over 10 times increased.
I guess roughly, 10 times. So that sort of growth can be hard to cope with. So what sort of bottlenecks or friction points have there been at Amwell as you've grown, taken on this surge in use? I mean, are there either staffing issues or technological issues or just what are the, again, that sort of growth would be hard to cope with. So I'm just curious what's been different.
Well, in the second quarter, it was an all hands on deck moment, as it was, for most healthcare providers around the country. A little bit different for us because there was such a dramatic shift from in-person care to telehealth-based care. Certainly, that put strain on our product and hosting teams. There was an incredible need. I mean, when you're a software company, you plan for 2x, 3x, 4x growth. You don't plan for such dramatic growth overnight. And so there was some scrambling there to meet the hosting requirements. There was a shift to a little bit more cloud-based hosting and some other things that I'm not probably qualified to comment on, but a lot there. On the patient care side, we needed a lot more providers very quickly, and we needed to bring them on in a way in which they were properly trained and qualified and credentialed. So there was quite an all hands on deck moment to recruit and train and re-engage providers who were credentialed already but inactive. So a lot of work there. We did see some surges in wait times very briefly, and we got those quickly under control as we brought on more and more providers.